Hello, I'm Tim Sandle and I'm a pharmaceutical microbiologist, and this is the fourth in my series of short videos on the coronavirus pandemic. So last time we looked at social distancing. Today's subject is about epidemiology, what epidemiologists are trying to do. And I'll also touch on the subject of immunity passport, which is being discussed particularly by some politicians, and the accuracy of some of the tests for coronavirus. And these themes feed into the lockdown, why the lockdown matters, and why it's important that we continue to abide by the lockdown. This is one of the key things to get us through this current crisis. Now, around the world, governments are caught between dealing with the competing urgencies of abating the COVID-19 health crisis, balanced with the looming threat of economic recession. And this will remain complicated until an approved drug, or better still, a COVID-19 vaccine becomes available, but this is still way off. So it's why we need to consider these other solutions, particularly around social distancing and lockdown, and these are essential to help accelerate the communities around the world returning to normalcy. Now, in terms of when lockdown measures can be eased, the work of epidemiologists is of great importance for understanding and tracking the virus. So, for those unfamiliar with epidemiology, this has traditionally been used as the model to examine the spread of diseases in populations. And by applying parameters related to responses to infection and looking at a network of contacts, this helps scientists to study how diseases occur, how they spread, and how to prevent epidemic and panepidemic outbreaks. So epidemiology is an area of scientific study that identifies the factors that pose a risk to the health of an individual in relation to a certain disease. So what about the current coronavirus situation? Well, the first human cases of COVID-19, as is well established, were identified in Wuhan city in China in December 2019, although with all probability they could well have been a bit earlier. And the source of the infectious coronavirus, the SARS-CoV-2 virus, is not completely understood, but it's believed to be a zoonotic virus, which means that the virus jumped the species barrier and can be transmitted between people, animals and people, probably starting with bats, moving on to anteater type creatures and then to people. As of April, late April, where as we are now when I'm recording this, there's over 2.5 million cases of the coronavirus worldwide, and there's been pushing around 180,000 fatalities. And extensive measures are in place to reduce person-to-person transmission of COVID-19, and these are essential to controlling the outbreak. And we discussed those in the previous videos: social distancing, hand sanitisation and masks. And the public services and facilities are also providing decontaminating reagents for cleaning hands on a regular basis. Physical contact with wet and contaminated objects are essential to understand in order to help contain the spread of the virus. And we also know that fecal and urine samples are also carrying the virus. There's been evidence of that in examination of wastewater supplies as well. And many countries have implemented these major preventive and control measures, And adding to that, there's also things like travel screening as well to help spread the virus. And it's important that scientists continue to study the disease and patterns of infection, which then gives information to governments so they can assess how effective the controls are and whether these are working, and then to make subsequent recommendations. So for this, epidemiology is essential. And the only way to answer questions like, can the lockdown be lifted? When the lockdown can be lifted can be only answered through the collection and assessment of data. And epidemiological changes relating to COVID-19 infection are being monitored around the world, taking into account potential routes of transmission and subclinical infections, in addition to adaptation, evolution and overall patterns of virus spread among humans, and also looking at intermediate animals, reservoirs as well. However, there remain a considerable number of questions that need to be addressed. And these include details about who and how many people have been tested, what proportion of those tests have turned positive, and whether the rate is remaining constant or is subject to various variables. And from such analyses, specific and detailed public health measures can be implemented. So this is why at the moment no one can fully answer the question about when lockdowns will be lifted, how long social distancing will last for, and so on, because it's all about collecting data. And certainly for where I'm coming from in the UK, there hasn't been nearly enough testing in order to form a detailed picture. Now, some governments have been discussing this idea of immunity passports as a means of getting different workforces up and running. And this is about assessing those who have recovered from coronavirus infection. And an example of testing the feasibility of such strategies, there's a research project underway in Germany, which is a mass study to help quantify COVID-19 immunity in the population, and this data will help in terms of lifting lockdown measures. And this is coming from the Helmut Centre for Infection Research, so you can look that up online if you wish to. Now, the idea behind this immunity concept is that those who are immune could be issued with some kind of passport that indicates that they've had the disease, and they would then be exempt from any further restrictions on their activity. However, this idea of immunity passport has two problems, and these are based on limitations around current test methods. So the first relates to access to accurate diagnostic tests. So until more accurate tests appear and there's more of these tests, then that's always going to act as a knowledge block on medics and epidemiologists to try and make sense of the data and to categorically confirm level of infections and those people who are infected. Secondly, on top of this, scientists are still unable to properly identify immunity or to understand the risks of reinfection and the ability of someone who's had coronavirus to infect another person. And in response to this, the pandemic, there are various biotechnology companies developing COVID-19 test kits, and these are appearing through legitimate and less legitimate markets across the world. Unfortunately, and this is another complication to assessing epidemiological data, is that many of these tests are let down by their accuracy and their reliability. And it's certainly not helped by dubious diagnostic test kits making the headlines, where some of these tests that are being sold and marketed give accurate results as low as 30%. So clearly not giving any information of any real value. To make matters worse, any quick, easy or point-of-care diagnostics that provide results in minutes are notoriously unreliable. So often the faster a test kit says it will give the result, the chances are the less accurate that test kit would be. And it's important to note that the World Health Organization is cautioning against using test kits of this type. It also stands that very few of the tests appearing on the market have undergone rigorous testing and validation in order to ensure their quality and performance. And just to go back to a point I made earlier, many scientists are still unsure whether recovering from COVID-19 gives a person complete immunity against reinfection. Now, certainly most medical experts are estimating that it will take a couple of weeks after infection to build up the necessary protective levels of antiviral antibodies. And these may only be enough to keep infection at bay for a few months. And there are certainly cases in South Korea that are being investigated to look at why viral reactivation may be happening. Is this reinfection or to do with the virus remaining in the body and then resparking? Or it could be the consequence that certain test kits were never wholly accurate in the first place. It also stands that to have protective immunity, a person has to have the neutralising antibodies, and here this type of test kit is even less reliable than the test kits that are assessing whether someone has coronavirus at a certain point in time. And that's the division between the blood tests, which will look for the antibodies, and the swab tests of the throat that can indicate whether someone's currently got it. It also stands that test kits are not able to rule out whether a person who has contracted COVID-19 is still infectious. So that school of argument says that patients could continue to shed the virus long after symptoms subside. So it still means that if someone's had COVID-19, social distancing, among other measures, remains very important. So as things stand, social distancing coupled with good hand washing, hand disinfection remain the most important measures, as I've explained in some of the other videos in the series that are available on my YouTube channel. Okay, well that's it for now. I've been Tim Sandle. Please visit my YouTube channel to view other videos on coronavirus and other things related. And as always, I always recommend that you look at some of the points I've made for yourself and look at independent advice online. So that's it. Keep safe, and until next time, see you soon on a video. Goodbye.